Okay, so let's talk about barrier methods for birth control or contraception. In these methods, the big job is to try and keep sperm from getting to eggs. That we're going to barrier the sperm from the eggs. So one way that you can do that is by using spermicides. Now, back at the beginning of class, I mentioned that spermicides are sometimes present in condoms, and they do work for killing sperm, but not as effectively as you might think, and they probably shouldn't be used alone. And they probably shouldn't be used if you have sensitive tissues and things like that. In the spermicide category, we have foam that can be inserted into the vagina. We have the vaginal contraceptive film that can be inserted into the vagina, and it feels kind of like saran wrap. And then there's vaginal, it's like a cream that it comes in a tube. You just twist off the end and insert it into the vagina. The trick with all of them is that you're supposed to insert the spermicide and then wait 15 minutes for it to fully develop, and then it's at its maximum effectiveness. At its maximum effectiveness, if you use it by itself, theoretically about 18 women out of 100 will become pregnant. But in actual use, it's closer to 30% of women will become pregnant while using it. So using it by itself is probably not the most effective method. The correct use, according to the manufacturers, is to use it with another barrier method, either a condom or a diaphragm or something like that. And then the other aspect of correct use is to give 15 minutes in the body to warm up, to sort of loosen up and cover everything up that it's supposed to cover up, so that it'll be maximum effectiveness. The advantages of these methods is that you can buy them at the grocery store, you can buy them at the drugstore, so they're reasonably accessible and reasonably inexpensive. Of course, you can stop using them anytime, and fertility is available again. Minimal risk. Some people are allergic to these. It can make your tissues inflamed, and so it can open you up to, well, that's in my disadvantages, so hold on a second. I will tell you the risks in a second, but minimal risks. And then they are inexpensive. Now with the disadvantages, some people are allergic, and so they'll get a rash. There is that risk of increased STIs when the spermicide is non-oxynil 9. And then they really aren't that effective by themselves, so it's definitely for pairing with some other barrier. Male condoms. I like to show this video of this, how to use a condom, because it's, I think, pretty adorably creepy. But the proper use of condoms, you're supposed to, first off, make sure that the package is sealed. And that sounds really stupid, but there are creepers who go into the grocery store and, will pierce all the condoms, or go into wherever they have them in a free bowl, and they'll stab them with pins. So they're check to make sure that the package feels like it's full of air and it doesn't leak out. Once you've done that, then the next step is to check the expiration date and make sure that it's not too old, because condoms do lose their effectiveness. Latex and spermicide have shelf lives, so you increase the risk of a tear or ineffective spermicide if you have an older condom. Okay, so now you open up the condom package, and the trick is to make sure you know which way it's going to roll down before you bring it into contact with an erect penis. Remember, those Cowper's fluids can have sperm in them, and so if you have a fully erect penis and any Cowper's fluids have been emitted, and let's say you take your condom and you start to try and roll it down and you realize, oh wait, it's going the wrong way. You flip it over. Well, now anything that might have been on the tip of the penis is now on the front of the condom, like the first thing that's going to be introduced into the vagina. So for the male condom, when you're using it for birth control, you don't want to be, or for STI prevention, you don't want it to come in contact with the penis and then flip it over. So make sure you know which way it's going to roll. Make sure that if it doesn't come with a reservoir tip on it, that you make a little reservoir by twisting a little bit of it, and then roll the condom down and leave that tip, because at ejaculation you need the sperm to have a place to go that won't cause the condom to tear. And then the critical factor is that after ejaculation, the penis needs to be withdrawn from the partner, and then you stay away. You keep the penis away from the vagina after that. You have to just assume that there's live sperm anywhere that was under the condom. You want to dispose of the condom responsibly. You don't want to throw it on the street or in the bushes. You want to put it into some kind of receptacle. Do not flush it down the toilet, because it clogs up all the sanitation systems. So those are the proper uses of the condom. Okay, now the effectiveness. If you use it properly, following all the steps I just told you, about 2% of the time a person would become pregnant in a year. But in actual use, you see a much higher rate of failure. And that's because, people use them incorrectly. I think the biggest incorrect use is staying coupled, keeping the penis inside the vagina and letting it go flaccid while still in the vagina and the condom. That allows fluid to escape from the condom. And possibly, sperm are determined and they will get up into the vagina if they can. The advantages, of course, are that, you can acquire them practically anywhere anymore. You can stop using them anytime and return to fertility, minimal risk, inexpensive. And then this is the one method that protects against a lot of different STIs. Not all of them, and we'll talk about that in that chapter, but it helps to prevent the transmission of STIs. The disadvantages: some people are allergic to latex, and then you have to buy the more expensive polyurethane ones. It's the polyurethane ones, you might think, well, I don't know if I'm allergic, I'll just go with those. They tear more easily, so it's a kind of a trade-off. It's easy to use them incorrectly. Like I said, staying coupled, not leaving a reservoir end, touching the end of the penis and then flipping it over. I mean, it's really easy to do something wrong. And then, of course, some people complain that it interferes with spontaneity because, you're at the height of passion and then you have to stop and put on a condom. So a lot of people don't like that disadvantage. So condoms have pros and condoms have cons. How about the female condom? This video from Planned Parenthood talks about condoms, shows you kind of what they look like and things. The idea with a female condom is it's basically a long tube that has a ring at the top end, on the sealed end, and then that is flexible, and you can use it to insert the condom into the vagina, and then has another ring at the base on the open end that allows you to sort of cover up the labia and allow for insertion. They're made out of polyurethane. They look a little off-putting. A lot of people find them not that attractive looking, but they can be a nice alternative for a lot of things. Theoretically, there should be about a 5% failure rate. In actuality, it's more like 20%. I think because a lot of people don't use them correctly, like they'll insert them and then instead of guiding the penis into the opening of the condom, the penis ends up between the condom and the vagina. So it's like you weren't even using a condom at all. The advantages of the female condom are by and large the same as the male condom, but there's this added advantage that if you want to come in prepared and have spontaneity, you could technically insert the female condom up to 8 hours prior to sex. If you watch the video and see what a female condom looks like, you can imagine that it seems odd to imagine that you'd walk around for 8 hours with a female condom in, but for some women, it makes them feel like they have control over their fertility in a way that other things don't let them do. Disadvantages, same as male condoms, and the additional issues are that it's harder to find them. You have to go to some place like Planned Parenthood or something like that to find female condoms, and they are more expensive because they're made out of polyurethane. They're bigger, so some people will reuse them. They are not for reuse. You got to buy another one. Yeah, I don't even know if I needed to tell you guys that, but some people reuse them, and so yeah, you don't do that. Some men who have sex with men report that the female condoms are an advantage for anal sex also, and that they can insert them in, and that one of the things about the female condom from the male side, from the person who's going to be the penetrator side, is that the penis is allowed to move freely within the condom, whereas with a male condom, the male condom moves with the penis. And so for the penetrator, they say that sensitivity is enhanced. For the recipient, they oftentimes say it's not really any different for them than a male condom, because either way they're feeling a layer of something, and in some ways it's less problematic with a female condom because you don't have like the friction of latex on the vagina walls that are secreting vaginal fluid and stuff, and so you don't get some of the mess that can be associated with male condoms. So, but they aren't, so there are some advantages, but they aren't very popular. People don't use them very often. How about the cervical cap? This is a method where you get this from your doctor and you insert it over the opening of the cervix. And before insertion, you fill the cervical cap with spermicide so that if any sperm does get around the edge of the cervical cap, it will be killed by the spermicide. This method is, it depends on whether you've had a baby before or not, whether it's going to be effective for you. Theoretically, only 9% of women who have never had a baby should become pregnant while using this method, but really in actuality almost twice as many women will become pregnant with it. And for women who have had babies, this is not a very effective method. The 26%, theoretically, in actuality more like 32%. So it's probably best for women who have never had babies before. The advantage of this method is that you can stop using it and return to fertility. It doesn't have really any risks associated with it except for pregnancy. And again, you can insert it up to 8 hours before sex, so it has a little bit more spontaneity. But it's really easy to miss the opening of the cervix when you insert it, and so then you've just got it sort of stuck to the side of the uterus, and sperm are enjoying a nice straight shot into the cervix. You need to leave it in place for up to 6 hours after sex. And so if you were to have inserted it 8 hours before and then left it on for 6 hours after, you can imagine that's going to really increase the risk of toxic shock. And so it's not really advised for anybody who's ever had toxic shock before. And you probably shouldn't be leaving it in for 14 hours. So it's kind of an issue. It's not really appropriate for women who have cervical prolapse or other kinds of things. So for some women, it's really not a great method. How about the diaphragm? It's sort of like the cervical cap, but bigger. And again, you put a bunch of spermicide on it, and then you insert it and seat it over the cervix. But as you can see here, it's not like suctioned on like the cervical cap is. It's just sort of cradling the cervix. Theoretically, only about 6 failures per 100 women, but in actual use, it's about twice that. It has the advantage, all the same advantages of the cervical cap. You have to get it from the doctor, just like you have to a cervical cap. The disadvantages, same as the cervical cap, you do need a prescription, and if you gain or lose 10 pounds, you have to be refitted. And if you've had a baby, you have to get refitted, and things like that. So you don't just like have one diaphragm and use it for the rest of your life, which is actually a good point to mention. The cervical cap and the diaphragm are reused items. So you would take them out, wash them, let them dry, sanitize them, and then you use it again. The sponge is an over-the-counter kind of variant of the diaphragm. It's kind of diaphragm-ish shaped, but it's made out of sponge, and it's all impregnated with spermicide. So before you have sex, you run the sponge under the faucet and get water on it, and squeeze it till it gets foamy, so that you've activated the spermicide, and then you insert it and try and seat it over the cervix, so that now the sponge is going to absorb the sperm, and then the spermicide is going to kill it. So I have a nice little piece from Seinfeld about the sponge and whether a person is sponge worthy. I like to break up this boring medical class with some other stuff. So the effectiveness of the sponge, again, depends on whether you've had a baby or not, and it looks a whole lot like the cervical cap in its effectiveness ratings. If you've had a baby, probably not the best method. The advantages of this method is that they have all the same things, all the same advantages as the cervical cap or the diaphragm, but it has the advantage of not having to go to the doctor. You can just buy it at the grocery store. Of course, the disadvantages are the same as the cervical cap or the diaphragm, and the same as spermicide, right? Because you've got the spermicide in it. Plus, you'd need to have access to water some way or another. Either you have to bring your own bottle of water or something, because you've got to activate the spermicide. And some women who use this method report that they have higher rates of urinary tract infections. It could be that the bulk of the sponge is allows the penis to sort of compress on the urethra, and that makes it irritation. It could be that you have to, the length of time that you need to leave the sponge in after is allowing for bacteria to develop and things. It's really unclear, but women who use this method report UTIs at a higher rate. Now, the intrauterine methods are a method that went out of favor for a while and now has come back and is better, and more people are using them. A lot of times we'll refer to intrauterine devices as IUDs. And the idea with an IUD is that you're going to insert some kind of object into the uterus, and it's going to interfere with implantation of a fertilized egg. And then some methods go beyond that. So like Paragard is a good example of one whose sole purpose is to disrupt implantation. The fact that it's made out of copper means that it emits these ions that seem to interfere with the hormonal profile that make it less likely that you'll ovulate without having to actually use hormones for that. You can leave Paragard in for up to 12 years, and it's supposed to maintain its effectiveness. Skyla is a method that works for 3 years at a time, and it works in the same basic way, but it contains actual progestin. So that's how it interferes with ovulation. And then Mirena is same basic thing as Skyla, but it lasts for 5 years, so it contains more progestin. Now, if you look at the picture of the IUD in the uterus, you see that there are strings coming out from the IUD that are detectable in the vagina. And so the doctor inserts the IUD, and then the woman's job is every month to be checking to make sure those strings are still present. And if they ever are, she can't feel them, she needs to go to the doctor and see if maybe the IUD has moved up into the fallopian tube or pierced the uterine wall or something like that. So her main job, her responsibility as far as maintaining it, is to check for those strings. Let's see. So this video shows us how the IUD works. It's a little snarky because it's from Stuff. And so it's a little snarky and takes some jabs at people, but it basically tells you how an IUD works and how long it works and stuff like that. So now if fertilization does occur, which it sometimes does, sometimes sperm can get past the IUD, get up into the fallopian tube, and for whatever reason ovulation has occurred, then the fertilized egg will start making its way down the fallopian tube, and then the IUD does its second job, which is to disrupt implantation. So the IUD can be a controversial method of birth control for some people because it can allow the sperm to meet the egg and then has that secondary effect of prohibiting implantation. And if implantation does occur, it disrupts with the implantation. So some people don't like this method of birth control because of their religious beliefs. And that's kind of the snarky thing that she was referring to. She goes, it doesn't allow ovulation. Well, I mean, stuff happens. It's supposed to not allow ovulation. But if it does happen, there is that backup protection in the form of not allowing implantation. So the effectiveness. Well, remember, you're going to have this inserted by the doctor. So the theoretical and the actual use tends to match at 1%. So it's a really, really effective method. The correct use, like I said, you're supposed to check for the string. They say after every period, but then one of the side effects of using an IUD is that you may not menstruate ever anymore. It may be that you menstruate pretty heavily right after you've had it inserted, and you may menstruate, like every 2 weeks for some amount of time. You might have breakthrough bleeding periodically, but you may not menstruate at all. So then you just have to set up a little chart and called a calendar, I guess, and remind yourself to check for the strings. The advantages. All these long-term options all have these great advantages. If you don't have to do anything, if you know you're not wanting to have any more kids or any kids, you can, kind of set it and forget it for a really long time. The IUDs that contain hormones add the benefits that come along with the other hormonal methods we talked before. And then if you go with the copper version, then you can say, well, I'm getting all these benefits, plus I'm not adding any hormones to my body. So some people like the copper method. The disadvantage is not everybody really is a good candidate for IUDs. People who have had a lot of pelvic inflammatory illnesses probably shouldn't be getting IUDs. A person who's had an ectopic pregnancy before probably shouldn't have an IUD, because these things can be increased by the presence of an IUD. And like I mentioned, you could have really heavy bleeding, and a lot of times you go into it expecting no periods after insertion, and then you've got not not only are you having periods, but they're heavier than they were before. So not everybody's satisfied when they get an IUD. A lot of people are. Something I didn't mention on my disadvantages list is that when you go to have it inserted, it can, they have to dilate your cervix a little bit. And so that can be painful during the insertion of the device. And then the other thing I didn't put on the list that some people complain about is that their male partner sometimes will complain that the strings actually poke the head of their penis when they're having sex. And so that can be a problem. The strings are not rigid, but they aren't completely soft either. They're made out of surgical grade polyurethane, so they can be a little bit pokey sometimes. Okay, and then our final method is voluntary surgical contraception. Never going to have kids after this. For women, it's called tubal ligation, and tubal means tube, and then ligation we're going to cut. And tubal occlusion is where we're going to block the tube. And there's actually the one I've got in this picture, I just saw maybe 3 weeks ago on the crawl on the news that this particular method has been associated with perforating the fallopian tube. So this may or may not still be on the market for long. I don't know. But what it is like basically a spring, and it's supposed to irritate the fallopian tube and make scar tissue grow over it. Now for men, it's called vasectomy, and we talked about this in chapter 2, that you would sever the vas deferens. You either can cut it or inject it with glue or tie it off. I mean, there's a lot of different ways that they can cut the tubes or sever the tubes or whatever they're going to do. These methods should be assumed to be permanent, because once these things have been cut, efforts to reattach can be hit or miss. You may not be able to get those tubes back together. So if a person is having voluntary surgical contraception, they better be darn sure that they do not ever, no matter what happens, ever want to have kids or have any more kids. Like, this is it. I don't want to be fertile anymore. One of the so here we have a person who's had a vasectomy. One of the biggest questions I get is that, after you've had a vasectomy, is it like being neutered? I get that question a lot, and it's not like being neutered, because when we neuter animals, we not only don't want them to be fertile, but we also don't want them to have the effects of testosterone, because that's the kind of thing, like in a dog, that makes them want to run around the neighborhood and get in fights and stuff like that. So we want them not to have the testosterone either. So we actually remove the whole testicle in an animal. In a human male, all we do is sever the vas deferens, because of course men need their testosterone. That's the number one question I get. No, you still have all your testosterone. You're actually still producing sperm. So then the next question I usually get is, well, where did the sperm go? They get reabsorbed into the bloodstream. Just like if you don't ejaculate every single day, your sperm that it has ripened and would have been ready to be ejaculated today just gets reabsorbed into the bloodstream. That's actually one of the ways we can tell that a man has reached puberty or a boy has reached puberty, is that he has live sperm in his blood, because he's reabsorbing it. So the sperm just gets reabsorbed. Now, initially, right after surgery, there may be some swelling of the testicles as the body's trying to catch up with, absorbing so many sperm, but it usually doesn't last but maybe a month, something like that, and then it goes back to normal. The last thing I get asked, hopefully you already know the answer to this question, I get asked, can you tell at ejaculation? Because, wow, you lost all that sperm, and so now, are you firing blanks or something like that? But of course, as you guys know, most of the fluids come from the seminal vesicle and the prostate gland, and so only 1% of the volume comes from the sperm. So no, you can't tell at ejaculation that a person's had a vasectomy, except for that if you tested it, there's no sperm there. Okay, so the effectiveness of voluntary surgical contraception should be the same in theory and in practice, right? So tubal ligation and tubal occlusion and vasectomy, these are all really, really, I mean, like we're looking in out of 1,000. No, this would be out of 10,000 people. 5 out of 10,000, 3 out of 10,000, 2 out of 10,000. So it's very, very highly effective method. Correct use. You would want to, if you've had a vasectomy, use something else for at least 10 ejaculations to make sure that you've cleared everything out. And then really, you want to have the semen sample analyzed before having unprotected sex. I had a student a number of years ago who told me that his wife got pregnant with their first child while she was using birth control pills. And first child was a condom baby. Second one was birth control pill baby, got pregnant with that. So had a failure of condoms, failure of birth control pills. So then he went and got a vasectomy after the second one was born, and then he never went and got his semen analyzed, and so then they had their third child. It's rare, but that's the number one cause of a failure rate with vasectomies, is not checking to make sure that there's no live sperm. With the tubal ligation and tubal occlusion, there's like a length of time that you're supposed to wait before you have sex, because you've got to let the occlusion grow and stuff like that. The advantage is same as any other long-term option. You don't have to worry about it. And then the added advantage of it really is permanent, so that for the whole rest of your life, you don't have to worry about this. The disadvantages are that it's permanent, so that if you make a decision to have it done and then something about your life changes and you realize that actually you do want to have kids, you shouldn't count on the possibility of a reversal. That, oh well, I'll just go get it reversed. It's not just to get it reversed. It may or may not work. It's a very invasive procedure. Some people have floated the idea of everybody banking their sperm or banking their eggs and having surgical contraception, and then when they do want to have kids, just go to the bank and retrieve their gametes and have IVF. That's not probably the best plan, because power outages happen, sperm banks could go out of business. I mean, all these things could happen, and then you've lost your fertility. And so it shouldn't be used as like a frivolous thing or something that you think right now. And in fact, a lot of doctors are really super careful about performing these surgeries on people who are under the age of 30, or people who are unmarried, things like that, because sometimes people make these decisions not realizing where they might be in 5 or 10 years, and then they end up regretting it. So just really seriously, this is something to think about. All right, well, those are the birth control methods and contraceptive methods. Hopefully now you know there are a lot to choose from and a lot of things to think about.